Okay, welcome to Medical Terminology. And tonight we're going over the endocrine system. That's a very complicated system in the body. One thing affects another, which affects another, which affects another. So I'll try to do this as quickly as I can and kind of get to the points of it. Okay, and I'm going to minimize this. And let me move this out of the way. There we go. There we go. So the endocrine system. So it consists of endocrine glands. They're ductless glands. And basically it controls like so many body functions you can't even imagine. It monitors and interprets reaction to changes in the body and the external environment to maintain homeostasis, that balance that we have to keep all the time. Consists of many organs. And the way I explain this, in your brain, you have your pituitary and you have your hypothalamus gland, right? The pituitary gland, picture that as the king, but the king can't do anything without talking to the queen, which is the hypothalamus. So the pituitary gland, the king, is a little teeny tiny pea-shaped structure right at the base of your brain. And it's got two lobes, an anterior and posterior. It's the master gland because it controls almost everything. And the stimulation from the pituitary affects every other endocrine system organ that you have. So the anterior lobe secretes 6 different hormones. Adrenocorticotropic hormone, and that's all about regulating steroids like cortisol. Follicle stimulating hormone, which stimulates girls to have eggs mature or sperm produced in the testes. Growth hormone, which helps us all grow, regulates the growth of bones and body tissues so that we don't grow too large or, not enough. Luteinizing hormone stimulates the production of sex hormones by the ovaries of the testes, which would be estrogen or testosterone. Prolactin is the thing that stimulates the growth of breast tissue and milk production in females. And then TSH, thyroid stimulating hormone, which regulates your thyroid gland, which regulates your metabolic rate. And then the posterior lobe is only 2 hormones that are secreted. Antidiuretic hormone. So if a diuretic makes you pee, an antidiuretic makes you not pee, makes you hold on to urine. And oxytocin, which is the thing that makes women go into labor, stimulates uterine contractions. You have your thyroid gland, basically right at the front part of your throat on either side of your trachea, and that secretes 3 hormones, calcitonin, which decides how much calcium and phosphate are in your blood and in your bone. T3 and T4, it's also called T subscript 3 and T subscript 4, both of which are actually the hormones that increase your metabolism and your basic metabolic rate. So your parathyroid glands, they're 2 pairs of teeny tiny little glands that are underneath your thyroid, and they secrete parathyroid hormone, which also regulates calcium and phosphate, works with the calcitonin. Then you have your pancreas, which is an endocrine and exocrine gland. But from an endocrine perspective, it makes insulin, which is the Uber driver that takes sugar out of your bloodstream and brings it to your cells. And glucagon, which is basically sugar, stimulates the release of glucose from sites in the liver. So if your blood sugar runs low, a certain amount of sugar gets stored in your liver. Glucagon can actually tell the liver, hey, do a gluconeogenesis and put that sugar back in our blood. We're starving. We haven't eaten. The pineal gland, it's the thing that makes melatonin, which helps you sleep and also influences sex organs to mature. The thymus gland is where your T cells or a certain type of lymphocyte, white blood cells, are trained. It's very large as a child, but it starts to get smaller and smaller the older that you get. And basically, once you're an adult, it's teeny tiny and almost non-existent. The ovaries are the female sex glands, and they secrete estrogen and progesterone. The testes are the male sex glands, and they produce testosterone and make sperm. And so we're not going to go into all of this, but here are the combining forms. Pancreas would be pancreato, pancreatitis, for example. Thyroid gland could be thyro or thyroido. Thymus gland is thymo, and to secrete means crino, like endocrine. Endocrine meaning endo, within, and crino, to secrete. So the endocrine system is a system of secretion of hormones within the body, right? Isn't that clever? Your adrenal glands would be adreno or adrenalo. Anything that's a poison is toxico or toxo. Anything that's a sugar or that's sweet is either gluco, glyco, or glycoso. Things that are the same are homeo, calcium, calso, potassium, cal. So like hypokalemia, not enough potassium in your blood. If you are very thirsty all the time, that's poly, meaning many, dipsia, very thirsty. If we're talking about a poisonous activity of your thyroid gland, something that's poisonous like radiation to your thyroid gland, that would be thyrotoxic. If there's sugar in your urine, glycosuria. And if your blood has too much or an abnormal level of glucose, that would be hyperglycemia. The instrument that we use to measure sugar in the blood is a glucometer. Too much urination or excessive urination is polyuria. And a condition of deficient insulin is hypoinsulinism. And something that secretes internally is endocrine. Secreting outwardly is exocrine. And enlargement of the thyroid gland is thyromegaly, also called a goiter. Somebody who studies poisons is a toxicologist. Inflammation of the pancreas is pancreatitis. And enlargement of the extremities is something called acromegaly. And that's also actually a disease where there is too much growth hormone and it doesn't stop getting produced. And these people live short lives and they become very large, large arms and hands and legs and feet and head specifically with kind of a normal sized trunk. It's a very sad disease. Sugar in the urine, glycosuria or glucosuria. A tumor that's composed of insulin, insulinoma. Blood condition with potassium would be kalemia, right? So cal meaning potassium, emia of the blood. So now we're going to get into these diseases, which I'm just going to give a quick overview of. Graves' disease is an autoimmune disease that causes hyperthyroidism, which means your thyroid gland's overactive and you're thin, you're always hot, you eat and eat, you don't gain weight, you really don't get tired, it's like you in overdrive. One of the cardinal signs is exophthalmos, and it's those Wendy Williams googly eyes, right? Like you see here. And all the things I said, the elevated metabolic rate, you can't take heat, you're always hot, weight loss, fatigue, muscle weakness. The thyroid sometimes enlarges, and that's called a goiter. People can go into something called a thyrotoxic crisis or thyrotoxicosis or thyroid storm, which everything in your body is in overdrive. And so what can happen is your heartbeat is so fast, tachycardia, that it can lead to arrhythmias. And it can lead to death, actually. That's a very serious condition. Treatment would be, there's a couple medications, methimazole, propylthiouracil, and sometimes radioactive iodine. If all else fails, we have to remove the thyroid. And if we remove the thyroid gland, the person's going to be on thyroid replacement hormones for the rest of their life. And then we have cortisol, which is your body's natural steroid. If you have too much, you have Cushing's syndrome. If you don't have enough, you have Addison's disease. So Cushing's is caused either by a problem with your pituitary, like a tumor, or long-term use of steroids like methylprednisolone. And this is what somebody with Cushing's looks like. They have a moon face, acne, facial hair, because it's usually women, a buffalo hump, central obesity, striae, stretch marks, et cetera, et cetera. And they usually develop diabetes because of the problem with insulin resistance. We're not going to go into the catabolism of it and all of these things. Let's move on. Growth hormone imbalance. So somatropin is responsible for the growth of your bones and cartilage. Hypersecretion can cause one of two things: acromegaly, which is when it happens during adulthood, or gigantism, which is hypersecretion when you're a kid. And what that does is gigantism, you just keep on growing, but all of you keeps growing. With the acromegaly, it's the hands and arms and legs and feet, the extremities and the head. And if you don't have enough of it, then dwarfism. And this is kind of like what the face looks like for somebody with acromegaly. So the growth plates fuse. So, and the changes happen over time, but the face kind of gets comically or cartoon-like enlarged. physical deformities, and they have a lot of other problems. And usually they have a very short lifespan. There's some examples of gigantism, excessive growth because the levels are too high. And it's quick, abnormally increased height, like really fast. And dwarfism, the opposite. Normal body proportions, but just smaller. That's versus a midget or a little person where the proportions are off. Okay, so they're two very different things. And how do we treat it? Drug therapy, usually. And let's move up. Diabetes mellitus, right? And it's a group of metabolic diseases that usually are because either your pancreas can't make any or enough insulin, or there's a problem with the cell having a resistance to insulin, or it can be both. There's two forms, type 1 and type 2. Type 1 used to be called juvenile diabetes. It's not called that anymore. It has an immediate and quick onset, like out of the blue. It's congenital, and it's diagnosed at a young age. Whereas type 2 diabetes, which is a big problem in this country, comes on very insidiously, usually in overweight, sedentary people that have, very bad eating habits and a very sedentary lifestyle. Glucose levels, when they start to elevate, every time the sugar in your blood is high, it's destroying nerve endings and capillary beds. So there's a whole sequelae of events that happens with people with diabetes mellitus if it's not well controlled. And with type 1, the symptoms here, the 3 Ps are symptoms of both type 1 and type 2. Polyphagia, I eat all the time. Polyuria, I pee all the time. And polydipsia, I'm thirsty all the time. Right. So they're the same. And with diabetes type 2, that's preventable and reversible, but type 1 is not. When you have it for life, and you will be on insulin until the day you die. So what's a hormone? It's a chemical produced in one part of the body that regulates activity of an organ or a group of cells someplace else. Exophthalmos is boing, googly eyes, right? The protrusion of the eyeball caused by a hyper or hypothyroidism, or it could be even a tumor. Glucagon is a hormone that raises blood sugar. Hirsutism is growth of hair in unusual places due to abnormal hormones. You see this with women typically who will have excessive facial hair, like a mustache and a beard. And it's usually due to excessive male hormone like androgen. Myxedema or myxedema coma is severe hypothyroidism where they'll start to develop edema in the hands, feet, and face. The thyroid activity gets so low that they're basically going to go into a coma, and the metabolic rate is just slowing down to the point where they eventually can die. Insulin and where it's given, I'm not going into that, and I'm not going into glucometer and blood testing with that and different types of administration of insulin, but there are insulin pumps now that really have helped people out a lot, so they don't have to withdraw the insulin from a vial into a needle and syringe and then administer it. This just kind of checks their blood sugar and gives them a bolus of insulin when it's necessary. Hypophysectomy, it's taking the pituitary gland out, and that's a major surgical procedure. Usually we will go through the mouth or the nose to get in there, or they may need a craniotomy, which is where we remove a portion of the skull, of the frontal bone of the skull, to get into the brain to remove a tumor. And fasting blood glucose, how much sugar is in your blood after you haven't eaten for 8 hours. Glucose tolerance tests, they use these for gestational diabetes as well as regular diabetes. You fast, they check your blood sugar, they give you this disgusting syrupy drink, you drink it, and then they wait a couple hours and check your blood sugar again. And depending on the number, if it's anything greater than 200 after 2 hours, then we're concerned about diabetes. I'm not going to get into the radioactive uptake and thyroid function tests. Here's some words. Deficient calcium in the blood, hypocalcemia. Too much, hypercalcemia. A tumor of the thymus gland, which by the way is almost non-existent, so rare, is a thymoma, which is fun to say. Enlargement of the thyroid gland, thyromegaly, also known as a goiter. Too much sugar or glucose in your blood is hyperglycemia. Urine that contain sugar is glycosuria or glucosuria. And let's see, we're not going to get into pharmacy and supplements and different types of pills. And wow, that is the end of that chapter. All right, let me stop my share and let me stop my recording.